If you're a woman, this video is for you. And actually, some men, this is also going to apply to you. If you have the opportunity to get a mammogram or any form of preventative health screening to prevent cancer, in this case, breast cancer, take advantage of it, okay? Because it is so easy to say I am young and I don't feel like I need to get a mammogram. Let me tell you, prevention is better than treating or curing. Always, okay? And if you're a Black woman, the rate at which we are having cancer, breast cancer, colon cancer, gastric cancer, different types of cancer, it is absolutely alarming, and especially breast cancer. There are so many people who wish they were given the opportunity to get a mammogram, because if they had had that opportunity, they would have had an early diagnosis and early treatment. And so if you're given the opportunity to get a mammogram because you're 45, and yes, you are at the right age to get a mammogram, go do it. Isn't it better to get peace of mind than to say, I'm young, I don't think I need it? Like, these days, when it comes to breast cancer, family history is not the only indicator of your risk for breast cancer. And so there's so many things you can. I have a friend who has breast cancer, and she's very healthy, right? But you can also have other risk factors for breast cancer that you're not aware of. I talk about insulin resistance a lot, but insulin resistance can lead to cancer. Men who have family members who have had cancer in the past are going to also be at increased risk of having breast cancer. Yes, men get breast cancer too. And if you're trans and or if you're whatever you are, if you have breast tissue, you have a risk of having breast cancer. And so if you have the opportunity to get free screening, take it. Okay, I have had a mammogram, I have had ultrasounds, and I'm not at the age, right? I was 27 when I first had an issue, and it was scary for me to be 27 and to, I think I mentioned it before, like one of my breast was bleeding, my nipple. I didn't know what was happening. I didn't know why. And obviously, if you see blood coming from one particular breast, then the worry is always going to be cancer, right? So we have to rule this out. So at 27, guess what? I was in first year of residency. I was getting mammograms, I was getting ultrasounds, and eventually I had to get surgery. But what would have happened if I had just ignored it? That, oh, I'm 27 and I'm not at risk for breast cancer. Who knows what would have happened, right? And so this is my PSA to every woman, especially Black women. If you have the opportunity to get cancer screening, do it. And if you have the opportunity to get it outside of the traditional medical system, definitely do it. Because like I said before, we're getting cancer much, much, much younger than what the screening is recommending.